All, this is Dr. Mubin Sayed from Drbeen.com. Welcome to one more show. So this is a continuation of the open forum that was supposed to be on Friday. Then we moved it to Saturday because we had Dr. Phillips with us. And so there was a part of it that was left, and we're going to discuss that today. With that, I want to discuss a few other things too. But how are you all doing? Sorry, I was looking for my glove. I cannot find it. So just give me 1 second. Maybe I'll try to see if I can find it. There it is. Excellent. So here is my glove that allows me to draw better. So with this, let's see. How's everyone? So Shahida is there. Welcome, Shahida. MJ, Doc, D. Diaz, Alan, Gold Country Russ, Samina, Susan, Nina, Leanna Mori, Paul, Sher, Jim, Susan, Nabu, Guy Telfer. We haven't seen Japan for some days. I hope he's doing well, or she. KHW11731, Carlos, Frankie, Nathalie, DM, Marco Kane, and so on. So once again, my apologies. This Saturday was a little chaotic. One, Luffy was very loud. And second, there were lots of trolls that day in the discussion. So having said that, let's start before folks come over, the trolls. I want to show you the catnip. So there have been many of you who have been buying catnips for Kyrie and Luffy. So here are the catnips for them. So I have them here for both of them. So as soon as they would come near me, I'm going to feed them or give them the catnips. They've been playing with catnips the whole day. Let me show you how Kyrie looks when she is high on catnip. Check this out. So this is Kyrie. Sorry for the grainy video. I just took it. She was sitting here and playing with after catnip, she is high. So check this out. This is Kyrie. Sorry, I have to share my screen. Give me 1 second. So this is Kyrie. Sorry for the grainy video. But after the catnip, this is what happens to her. So they both were just playing around and all going crazy. Yes, me too. So I'm going to put this catnip on the floor. So when Luffy comes in, we'll see if he likes it. All right. So once again, thank you, everyone. And let's continue our discussion. I'm going to try to continue finishing the COVID side first. Sorry, COVID, I'm saying. The Twitter side, there are just 3 or 4 questions, or maybe 5 or 6 questions. So let's finish them and we'll do some discussions here as well. So this is Drbeen.com. Then here, I would really love to do this. I am kind of very excited about my own country, US, and then also Israel. And it is funny that I try to pronounce Israel correctly, but of course not as correct. So many folks had commented under my video that, hey, great pronunciation. And some folks had said, I can tell you with complete accuracy or something, you are incorrect. So either way, Israel is what I could figure out the best to say. So here, if you look at it, 101 million doses have been given. 4.25 million doses a day. This is worldwide number. Again, this is Bloomberg. Link is in the description. In the US, I'm really encouraged. I'm really happy. 32.8 million doses have been given. 1.34 million doses per day. That is a great number. And I want to, of course, I continue to see some people say, well, Biden organized it, and some people say Trump. I think everybody who's in the administrations, Trump's role was to do the Operation Warp Speed and get us to the vaccine. And then there are businessmen who actually do not have a very organized mindset, and maybe their subordinates have them. So it is probably makes sense that Trump's administration didn't have a great plan together, but they had brought us the vaccines. And then Biden's administration, it seems like they came together and they put the plan together and ramped up the administration of the vaccines from 400,000 per day to 1.34 million. Although I believe that it was going to be 1.41 million and above. It was just that in the beginning, the train was moving slowly. Logistics were still getting operated upon and understood and so on. And then I had been saying that as soon as we become more used to doing this, then it would become fast. So both are good in their own ways. So here, 1.34 million doses per day for US. And I want to share this, that so these numbers, California, where I am, supply use 62% and 155 doses, 155,000 doses per day. But more interesting for me is this, Israel. Look at this. Now, out of 9.2 million people, 5 million people have been vaccinated. That's more than half of the population. So if you see here, 55.1 per 100, so about 55%. That is a big number. And so I really appreciate it, and I really am kind of looking forward with a very keen eye, because as soon as this number reaches 60 and above, ideally they should be reaching a herd immunity like number, and we should see the infections and the death rate to drop. And secondly, because they have given the vaccine, I believe more than 75% of the older residents, older citizens, older population, their numbers should start reducing anyway. So if you look here, this is Worldometer, and this is Israel's data. And if you see here, for me, there are some interesting things. Number one, if you check the numbers, for example, January 31, 4,646 new cases. And if I look at the 3-day moving average, they are coming down, but I think their weekend data reporting versus not reporting also creates some fluctuation. So if I go for 7 days moving average, I saw that there was a dip then, but then there is a tiny bit of an uptick. At the same time, if you go down here, this is very interesting, total active cases. So if you see, they are dropping. And similarly, if you go to the death rate, or the number of deaths daily, that is also now reducing. My hope is that this number continues to drop down now within next couple of weeks, because the vaccines are going to take effect. So 55% of the population vaccinated is a great number to look at, and the population to look at. I would hope in another few days, these numbers should really start going down. This number should start going down. So that is one. Then if you look at United States, so here, there is an interesting data point in US. So of course, if you see here, daily new cases have dropped. For example, January 31, new cases 151,661. If I continue to go find this kind of a number, it was here. So this, okay, so that is the average. So if I take the average out and I just look at January 31 daily cases, 110K. And so that is the number somewhere over here. November 4 is 110K. And since November 4, our numbers had been higher, and now for the first time they're dropping to this level, and I hope that they would continue to go down. The reason is 31 million people have been vaccinated, out of which majority is older population, older population here was contributing, or was more than 25-30% of deaths were in the older population. So one, we have vaccination there. Secondly, the healthcare professionals. So if you see down here, this is what is the interesting number or graph for me. This is for the first time. If you see here, this is how US has been trending. So it becomes sort of flat. This is active cases, or horizontal. Then it starts going up. And if you see here, for the first time, after this steep slope upwards, for the first time, it is becoming horizontal again. So that is a good outcome as well. And so I'm hoping that this number, the total deaths, is going to start becoming horizontal and then declining as well. So if you see here on the US number of deaths, daily deaths, as unfortunate as it is, if you see on January 31, 1,906, and if I look at this number in the previous days, somewhere in December's, and then in November, so kind of here, we are going down for sure in the deaths as well. Remember, there were days when we had 4,000 deaths per day. So now we are going down for sure. So that is something that really makes me happy that it is reducing. So I wanted to make sure that I look at that with you. So now back to the COVID. I keep calling Twitter COVID. So here is a interesting question from a Twitter fan or Cool Bean. If you read it, MT says, understand that bromhexine does not help with TMPRSS2 inhibition, yet you continue to suggest it may be useful. Why? And MT, if you look at all of my discussions, other than the bromhexine itself, I have always said that we haven't really found yet a 100% number that could be said that, hey, bromhexine 100% works. And so some studies say it doesn't, some say it does. And this is interesting. The one that you linked here, they outrightly say that bromhexine does not even interact with TMPRSS2. So here is the, where is that study? There is a study, I think it's in my description. I have it open there. Let me open it up again here as well. So here, this study or this data here, they simply say that it doesn't even work with bromhexine doesn't work. And I remember that I had done this discussion. That is why it is highlighted. However, there are other studies, and I have the links in this description, and I have the links in the previous descriptions that say that it does work. So, MT, to your answer, I have never been 100% comfortable with bromhexine, and I have articulated that many times. At the same time, there is so much confusing data. Some say that it doesn't work on TMPRSS2. Some say it works. So it's in the middle. Now, Kathy Wright says, is there any information out there about vaccine drug interactions, for example, voriconazole? So, Kathy, the most important thing is to actually look at the vaccine that you're talking about, thinking about, and look at their documentation, and they would talk about it. Having said that, look, vaccine drug interactions should generally not be an issue. So this is a general statement here. The reason for that is vaccine itself is not a drug that it is going to go and cause drug interaction. Drug interactions usually happen, for example, ivermectin goes and causes some liver enzymes to work more or work less. And now if those enzymes are working with some other drug, now they are not going to work correctly. For example, the blood thinners. Ivermectin goes and causes the blood thinner enzymes not to work correctly. The enzymes that detoxify the blood thinning drugs, ivermectin blocks them in the liver or slows their function. As a result, the blood thinning increases, or the effect of blood thinning drugs increases. Now that is a drug interaction. Vaccines do not do that. Vaccines' job is to get into our muscle, then be picked up by some cells, for example, fibroblast muscle cells, dendritic cells, macrophages, and then they are going to make spike proteins from there, and they are going to present them to our immune system, and immune system is going to get trained. The vaccine's job is not to go into the liver and cause any enzymatic changes. So this question generally is not valid as a drug, but still look at the documentation from the appropriate vaccine. Ilyas Moratis says, how long does it takes for our body to clear from ivermectin? I have read that it is stored in fatty tissues. Another question, what about caffeine and ivermectin? And last one is cholchicine necessary for the early treatment? So very quickly, if you see here, Ilyas, this is the pharmacokinetics of ivermectin. And I had shown another document on this Saturday as well about the pharmacokinetics and distribution of the ivermectin. Yes, ivermectin does go to fats. So if you see here, the tissue distribution of ivermectin was similar in healthy and onchocerciasis, the worm, volunteers treated orally. Infection with this does not appear to affect the distribution of the drug. The compound was present, the ivermectin, in fat, skin, subcutaneous fascia, and nodules, and in worm fragments. It showed the highest and most persistent levels, while values of skin, nodular tissue, and worms were comparable, being the lowest concentration found in the subcutaneous fascia. And down here, they say that the highest concentration is found in the fats. So finally, in the milk of healthy women, some of the ivermectin is released as well. So generally, yes, it can be stored in fat. However, its half-life is 18 hours. We've done this discussion. It is excreted in feces for days after its ingestion. So maybe that it is coming from fats, but still in the plasma, the half-life keeps going down every 18 hours, meaning it becomes half every 18 hours. Now, the second part of your question, it is stored in the tissue, yes. Another question about the caffeine and ivermectin, I do not know about the question here. What is the question, caffeine and ivermectin? And last one, is colchicine necessary for early treatment of COVID? Not necessary. So there is a study that says that colchicine, so here a gout drug shows promise for COVID-19, but skeptics worry about trusting science by press release. So the reason for that is that there is a press release that says, and it is by Montreal Heart Institute, and they are saying that we did a study for those people who were receiving colchicine, and they said that there was a reduction in hospitalization. Having said that, they did say the results were not statistically significant, although the numbers are close. So is it necessary? I won't say it. Somebody who's taking it for some other needs of theirs, they are probably a little bit more protected. It is an anti-inflammatory in multiple ways. So that is how it can help, and that's about it. Meaning if somebody is taking colchicine, they should be comfortable that it would help, but not statistically significant, but it would not cause harm. Carlos Ortiz says, hi, doctor, I want to get takeout, but I heard that there are more ACE2 receptors in stomach than in lungs. Would one expect a more severe disease if virus is ingested via somehow contaminated food as opposed to just breathed in? Good question. And we have done this discussion. This is an older discussion. So let me very quickly explain this. So here, let's say this is the stomach. And let's say that the virus actually entered the stomach. Virus can go into the stomach for a couple of reasons. One, when the virus enters our mouth, even through the breath, and it is here, part of it is going to go to the respiratory system, other is going to be swallowed and brought into the stomach. So that is just going to happen. And then, of course, if you have eaten some food which is contaminated, although I'll be really, really upset if the food is contaminated with COVID, because that means either somebody had touched it after touching their nose or their mouth, and their secretions are present, and they were sick with COVID, and they put that in the food. or they had used the washroom and they did not wash their hands. They touched their fecal area, their anus, that area, or they touched feces, something like that, or they flushed it while they stood there and the lid was not on, and the vapors on the flush that were coming up, and that tainted their hands, or and then they contaminated the food, and then we ingested it. So if you think about it, all of those reasons for contamination are poor hygiene while managing the food or handling the food, and that would really be bad. But let's say that happens. So now let's say that the food enters in our stomach and that food has COVID on it. So yes, you can say that COVID is now in the stomach, but please remember, our stomach usually, this is why the COVID can cause the gastroenteritis, right? COVID does cause gastroenteritis. The reason for that is COVID can escape the stomach acids because COVID has these lipids on its surface that protect it from gastric acids. And so COVID would cause inflammation of the stomach, plus it would continue on into the GIT and it can cause inflammation of the GIT. But this happens only in 4% of the people. Most of the time, when COVID goes into our GIT, we can manage it, we do not get sick, and it just sits there for a few days or weeks, and then it is excreted or thrown out, and it doesn't cause much of an issue. But it can cause gastroenteritis, it can cause diarrhea, it can cause nausea and vomiting, and so on. So back to your question here then, Carlos, I want to get takeout. So please do get takeout, at least places like US or those places where there is regulations. One can hope, I don't think it can be 100%, but one can hope that the food delivered will be clean. If it is clean, then you don't have much to worry about. If it is not clean, then we know that at least 4% of the people do get gastroenteritis from COVID. But the question about ACE receptors, that's not the problem, because our GIT handles this virus differently. Yes, GIT has, kidney and GIT have the highest levels of ACE2 before lungs and other things. But still, our lungs get more affected than our GIT. Our GIT is a little hardy thing. It gets viruses and pathogens all the time with our food. RP Viral says, hi, Dr. Bean. I have seen a claim from Gamaleya that the first dose of Sputnik vaccine. So we talked about it last time as well. This Twitter, somehow the thread got shuffled and some of the things went down and some came up. So we talked about it last time about Sputnik saying that, hey, because J&J is effective, we are like J&J, we use the same adenovirus number 26, so we are effective as well. And I had answered this, that that's not the way to look at it. Vic RV says, what are your thoughts on Amantadine? And I talked about Amantadine last time as well. There are a couple of links to. So if you see here, this is one link that I had, and I looked at it last time with us. That is, Amantadine may have antiviral activity. This is antimicrobe.org. And if you see here, mechanism of action, Amantadine interferes with the release of infectious viral nucleic acid, RNA, into the host cell through interaction with the transmembrane domain of the M2 protein of the virus. So the virus is proteins that fuse with our cell membrane and then allow the RNA to enter our cells. So Amantadine can interfere with the viral fusion with our cell membrane, which is a fair thing. Does it really do that for COVID is a question to be answered. And here is the reason I think that you asked this question, and that is this one. So this is Pharmacy Times, and in here they talk about a clinic who said an observational study from Mexico followed 15 patients, a small, very small observation study with clinical symptoms of COVID-19. So symptoms, not clinically proven COVID-19. All patients were prescribed Amantadine, and most also took several other medications. So they maybe something else. None of them required hospitalization or mechanical ventilation. After 14 days of treatment, all patients had IgG antibodies against SARS-CoV-2. And again, this sentence somehow makes it look like it was something to do with the amantadine. Somebody who was sick with SARS-CoV-2 would naturally develop antibodies against it after 7 to 14 and onwards days. So this is too small a study. It is an observational study. All I can infer from this is that if somebody is taking amantadine, there may be some help from amantadine, but this does not tell me that this would be preventive. MT says, could a vaccine made from entire virus give more protection against mutations than one that only presents spike? And we talked about it last time as well. Yes. Entire virus will include, so if I can very quickly draw that over here. So this is, let's say, the virus. And virus has RNA in it. It has nucleocapsid proteins on the RNA. Then it has other enzymes. And it has M proteins. And it has the spike proteins themselves. And then virus has other proteins in its structure. So if there are antibodies that are targeting almost every part of it, which would be the whole or inactivated virus, then yes, we have a bunch of more kind of antibodies to attack this. The problem only is that these antibodies could become just the binding antibodies and not neutralizing antibodies, which may have, and I don't want to be a fear monger here, it may become a chance for ADE that the binding antibodies are more, which are really not stopping the virus, but they're just binding to it. And now they have become a receptor. These antibodies have become a receptor for immune cells, and they are going to eat up the antibodies with the virus, and that may cause ADE. Not proven in COVID, even in non-human primates, for example, chimpanzees. This is not proven that antibodies can cause ADE. So me saying this should not be used as Mubin said, this can cause ADE. There is no such example so far. Excuse me. My HEPA filter. So is it better to have more antibodies? Yes. Is there a theoretical chance of ADE? Yes, but it has never been observed. De Magtoto says, thank you for all the info and effort you shared since the beginning. First question, we cannot deny the fact that one reason or another we have to get out of the house to buy essentials, correct? In the absence of ivermectin, is bromhexine enough? So once again, bromhexine, there are so many studies that say, yes, it works. And there are so many that says, no, it doesn't work. Instead, what I would recommend is, if you see here, in this study, which was used by a Coolbean as well to say to me that, hey, bromhexine doesn't work. In this study, they have actually talked about camostat or nefamostat or gabexate, which may work better than bromhexine. They are supposed to work with TMPRSS2 as well. So that is one. In the absence of what other drugs can we use for protection? So we have talked about it. Vitamin D is very important. NAC, CoQ10, melatonin, of course, K2, magnesium, copper, zinc, quercetin. So all of those, which I have discussed in the past, these are the supplements that may be useful. In terms of drugs, Eviptadil is important. This, of course, ivermectin is important if we can get it. And then quercetin and zinc, or hydroxychloroquine and zinc. And I wanted to show you something which, when I saw this for the first time, so let me stop sharing for a second so you can actually see my expressions. So when I saw this news the first time, I cursed a lot. And then I deliberately didn't talk about it because I thought I would lose it when I talk about it. So now enough time has gone by and people have sent me so many messages that why do you not talk about this? So let me show you this thing and then I'll tell you why I'm so upset about this one news, and that is here. So I hope you can see this. This is AMA, American Medical Association. And the reason I am unhappy and I'm angry, and probably this is the only news, if I had to curse and yell, this would be the one, because we are audited for this reason. And I told you that we've been audited for months now, and we are still under audit. Somebody had complained about us. But here, check this out. Emma, I think this is November's news. Emma comes out and says, now, this is American Medical Association, right? Check this out. Our American Medical Association rescind its statement calling for physicians to stop prescribing hydroxychloroquine and chloroquine until sufficient evidence becomes available to conclusively illustrate that the harm associated with use outweighs benefit early in the disease course. They say we rescind it. But check this out, the reason for rescinding, implying, so they're saying we implied, that such treatment is inappropriate, contradicts this implication of them, contradicts their own policy number H120.988 that addresses off-label prescription as appropriate in the judgment of prescribing physician. So what they're saying is, we asked doctors not to give hydroxychloroquine. And this was against our own policy that if there is a drug that has been approved by FDA, then a doctor has a right as a physician to use it in an off-label manner. So what a bunch of, where were they for the whole year when people were dying? They did not think of this policy at that time to come out and say, you know what, sorry, we were wrong and we rescind it. Then they continue and they say, the next resolution resolved that our EMA rescind its joint statement with American Pharmacist Association. And this is what makes me even more angry, because this was the reason that they were rejecting filling the prescriptions for hydroxychloroquine and rejecting filling the prescriptions for ivermectin. Because EMA joined hands with American Pharmacists Association to say to them that very good, don't fill it when a doctor sends it to you. American Pharmacists Association and American Society of Health System Pharmacists, so they rescind this as well and update it with a joint statement notifying patients that further studies are ongoing to clarify any potential benefit of hydroxychloroquine and combination therapies for the treatment of COVID-19. And then they continue on and they talk once more and they say, resolved. So look at it. This was EMA strengthening the Pharmacists Association to say, yes, we are with you. Don't give hydroxychloroquine. And if we have told doctors not to prescribe it. And so, of course, Pharmacists Association came out and said, you know what, if you're going to prescribe it, we're going to reject it. They were backed by EMA. And look at this, resolved that our EMA reassures the patients whose physicians are prescribing hydroxychloroquine and combination therapies for their early stage COVID-19 diagnosis by issuing an updated statement clarifying our support for a physician's ability now in November, after the whole pandemic is gone, not gone, but the whole year is gone by, clarifying our support for a physician's ability to prescribe an FDA-approved medication for off-label use, if it is in his best clinical judgment, with specific reference to use of hydroxychloroquine and combination therapies for the treatment of the earlier stage of COVID-19. So would they now cancel our audits as well? Because they were the idiots? Idiots. Anyway, sorry. I can be actually more angry. I am actually more angry than what I'm letting on. Okay, so So back here, I need to compose. King Kong. Is there any advantage to get the Pfizer Moderna vaccine and later get the J&J Novavax series to get more comprehensive protection? If you take a spike protein vaccine and then you say, I want to have the whole inactivated virus as well, then that could give you some protection from spike and then bigger protection from the remaining virus as well. But if you just keep taking the protection against the spike proteins, then that is of no use. For example, I shouldn't say no use, but it's not much additional benefit. So for example, Pfizer, Moderna are both spike proteins. Then J&J is adenovirus producing spike proteins. Novavax is a particle made up of spike proteins. So all of them are still going to continue to ask your immune system to make antibodies against the spike protein, which the very first vaccine would have done. So adding them is not going to be much useful. I'm sorry, I became so angry. In the absence of this discussion, I was yelling and cursing, and I was very animated because this is wrong. Did they just remember just now that we have a policy that a doctor... Think about it for a second. If physician is educated for two important things. One, what are the ways to manage or try to help with the drugs that they have learned? And second, how to learn to help. For example, with this pandemic, I did not know about SARS-CoV-2 and all of its properties. I learned about it and then I shared it. And the same should have been a behavior of every physician. This is their job, to learn how to learn and then use that for the benefit of their patients. How could this be a miss at a level like Emma? And imagine how many physicians they discouraged from prescribing by their statement. And imagine how they strengthened the Pharmacist Association or health system pharmacists to say, good job, reject it. When the Emma, they did not have sufficient data. So look, if they didn't have sufficient data, then why to say stop it? They don't know enough. They should have said, we do not know enough. We can't say give it or don't give it because we do not know enough. Or if they wanted to still venture out and say something, then they should have done something like I did. Go into the mechanism, come back and say, from a mechanical point of view, it seems like this is how it would work. So anyways, sorry. Just... Okay, so Stephen says, this is what I saw about 0.2 chlorhexidine. So I have this study open here about the chlorhexidine. So chlorhexidine, this is an article in a paper from India. And in this article, the paper is talking about a study. I could not find the study to go look at it. I should have actually looked at the study, because articles, we now, all of us know, journalists can just play the thing up and down. So here, what they're saying is chlorhexidine killed coronavirus within 30 seconds after being exposed in a lab. These are the initial results from the lab studies and need to be verified through clinical studies. So chlorhexidine, sure, useful, sure, but this is an in vitro study yet. It needs to be proven. So back here, Stephen says that this is what I saw. And then he said that previous studies that you mentioned, did they say the percentage used in the study that showed it didn't work? So Stephen, no. In there, I could not find data for exact percentages they had used. So maybe there is a problem with the percentage or the quantity used. Laura says, I thought it was Wednesday. Laura, the open forums, if you are hearing, I do not know if you would be there, but if you're hearing, we do open forums on Fridays. Nowadays, the questions have been so many that we spill over into Saturdays as well. And as you can say here, we have spilled it over into Monday as well. So usually Fridays. Jason Barr says, do you recommend taking ivermectin and hydroxychloroquine? I'm hoping this HCl is actually HCQ. At the same time, if you're getting sick, are there any ramifications for people with high liver enzymes or high serum ferritin taking ivermectin? So a couple of answers. Number one, I have used for my own patients hydroxychloroquine and ivermectin together. Number two, ivermectin is pretty safe. However, it is seen that it can interact with some enzymes and can cause some drugs, for example, blood thinners, to become more effective and blood thinning to become more. So I shared in my last, the open forum, I shared a link to the drug and its pharmacokinetics, especially the effect on the liver, to see how does it work with liver. For most of the drugs, it does not interact with them. Very few drugs. So the question here that you're asking, that if the liver enzymes are more, or let's say if the liver is not functioning correctly, then of course ivermectin's dose has to be reduced, because ivermectin is metabolized in the liver and then excreted in the feces. So if liver for some reason is not functioning correctly, then the dose need to be adjusted. Just a few more, just 2 or 3 more questions. I know that I am ignoring the live chat for the time being. I wanted to be done with the Twitter side. Margaret has a question here, comment here. Dr. Bean, no need to be sorry for pointing out the truth regarding mRNA. This is really weird for me, how these agencies, organizations work. We were put under audit for these kind of lectures. And if you think about it, every single thing that I had said has proven to be correct. And the reason is not that I somehow knew things. I was studying. I was looking at the studies. I was looking at the books. Remember, I did a discussion about WHO in which I opened up the books and I showed you pages from books from 2016 and 2010 and 2013. And I showed you that these things they had already written that we are rejecting today, that we do not know. So I feel there is a gap in the operations of some of these big communities. Who knows? Now I might lose the whole capability of running the business that we do. But oh well, I'll have to stand up another business after that. Zad Rad says, hello, Dr. Bean. There is a case of patient who has CSF. So Zad Rad, I read this, that somebody may have a compromised blood-brain barriers, which seems to be an emergency for me. I cannot comment on this one. So you're asking if ivermectin is safe for them or not. I cannot say it. So please talk with your neurologist, talk with their neurosurgeons, and they should be able to tell you what is going on with their blood-brain barrier. Only then can you decide. I cannot, not at all. I'm so sorry. Dallas for Life 44 says, although I was alarmed by the rate of infections in Israel for vaccinated people, isn't it more important to provide details of post-vaccination hospitalization and serious diseases? Even vaccinated can get infected and show positive PCR. We are trying to lessen sickness and mortality. So Dallas, you're correct. Number one, I am not alarmed. That 12,000 people getting sick, I still have not found data anywhere for that. There is news, but there is no backing up data. To me, it seems like that may have just been a preliminary thing that somebody said, and it took air and wings and it went all around the world. I do not see any data, number one. Number two, you are correct. After vaccination, the more important thing to show is, are people getting hospitalized? Are there deaths? And that reduction is the most important part. If coronavirus after a vaccination arrives in us and just causes mild flu-like symptoms and then goes away in a couple of days, so what? Sure. But it is the hospitalizations, it is the long hauling situation, it is the death that is very important. And so you're correct. And this is why it is interesting for me that half of Israel's population is vaccinated and the cases are dropping. This is Israel. What happens is it takes about a month after the vaccination for the actual protection to start, month or more. So we may have to wait a little bit, but at least the trend is downwards. And the same is the case for the trend with the deaths as well. So ideally, after 50-60%, this whole thing should go down towards zero because the herd immunity is 60%. And if it doesn't, then our R naught and herd immunity calculations will be wrong. Back here, Scott Robinson says, we need a good discussion of corona variants, the rate of mutation, and the likelihood of escaping the immunity generated by the vaccine. Sure, I have done this discussion a number of times, but maybe we should do this as a separate topic. Mirror 91, last one, and then I'm coming over to the live side. Mirror 91, hi, Dr. Bean, do you think pre-exposure prophylaxis with ivermectin is better than post-exposure prophylaxis in terms of prevention of illness and severity? Of course. Pre-exposure or the prophylaxis actually means using something before a thing occurs or a illness is exposed to us. So, of course, the prophylaxis is better. It helps prevent death. It helps prevent hospitalizations. It helps prevent long hauling state. So this is here. I saw that there is a super chat of $100. So thank you very much. Let me see if I can. I cannot scroll far back enough to see who it was. John Elderton. John Elderton, thank you very much. That is very, very generous of you. Okay, so I'm here now on the live side. Let's see what do we have here. So if you had a question, most of the questions when they appear or the commentary that appears, then it disappeared as well. So please write them again. We are at 47 minutes. Simple Garden says, Barbara says, Eric Anderson, vitamin D. Okay, so Barbara is talking with them. Simple Garden, I just saw a question from Simple Garden here. Have you looked into the niacin treatment theory? And please get a Patreon account. Thank you. Niacin, no, I would. And I promise you, I will do the Patreon account in a day. So let me actually leave a message for my executive assistant right now so she can remind me tomorrow. So give me 1 second. Okay, so reminder. Thank you very much. And I look into niacin. I'm going to go down to the bottom to the freshest, and then I'm going to go backwards. Jana Taylor says, I take NSE. And I have talked about NSE, yes. TD says, why does Emma suck so badly? I have no idea. They would love to audit people, but they cannot audit themselves. If they had any, if they could apply their own behavior to themselves, they would have to fire themselves. Any concerns with, so CC says, any concerns with inflammation in the brain or other neurological issues with people with Parkinson's disease? Thank you. Concern in what term? Using ivermectin? Yes. Any compromise of the blood-brain barrier, they should not use ivermectin. But if you're talking about any other issues, please tell me, can you clarify? Nina, what did Nina say? Okay, so Susan, Mr. J says, how could co-infection, catching two variants, affect the mutation and vaccine? If the Brazil mutation can re-infect, can we assume it can also co-infect? So of course it can co-infect, yes. So that is a possibility. Now the question, how could co-infection, catching two variants, affect the mutation and vaccines? Mutations happen in us all the time, correct? It is possible that there is a mutation on top of the existing ones, the variants, and so there are more and more mutations. Doesn't matter, there is mutation. The question is vaccines. So efficacy can continue to drop if there are more and more mutations on the spike protein. But at some point, virus has to figure out that can I create so many mutations that I can escape the vaccines, but I can still bind with the ACE2. Too many mutations will make it unable to bind. And it is actually happening. Everybody who becomes infected has millions of mutations in them. This is just part of assembly of the virus, that every time it, just like when we are formed, we all have these things, the eyes and nose and mouth and face, but everybody's face is different. It's not mutated, but it is different. Similarly, whenever the viruses are replicating in us, they make their mutations. Many mutations just die out because they are useless. They cannot really bind with ACE2. Some mutations survive, and some would have beneficial things in them for the virus. Some would have beneficial things for us to adapt to us. So we would just have to keep looking at the mutation to see if the efficacy changes. Good question. William Day says, what is a pulse therapy? William, whenever there is something used for a short period of time and then stopped, and then maybe used again at a later time for a short period of time and stopped, that is called a pulse. For example, I give steroid pulses. What does that mean? Instead of saying you take 10 milligram of delta cortril, for example, daily for a year, instead I would give 5 days course and stop. So that is a pulse. And then maybe a month later, another 5 days course and stop. That's another pulse. So that pulsing can be done with antibiotics as well. The benefit of pulsing is that body doesn't become used to that thing. For example, in case of antibody, the pathogen sitting in us may not become resistant with the pulses. But if you are giving some antibiotic for a continuous basis, there may be resistance that may develop. So that is the idea of pulses. TCS says, question, have you read paper discussing fat embolism syndrome and pathology of COVID? So TCS, we had talked very early on about the hypercoagulability, but I haven't seen specifically fat embolism with COVID. So would you be kind enough to send me a link? I would love to see this. France says pulsing is fascinating treatment. Yes. I always, with steroids especially, I do pulsing. I just don't give continuous unless there is somebody who needs it continuously for chronic disease. Doug says, hello, Dr. Bean, much respect, sir. Thank you. Have you gotten any report of people who take ivermectin on 2-week prophylaxis that catch COVID-19? Thank you, sir. So those studies that I had done, I had shared in the past, we still have similar or some more studies. There are some bigger studies still going on, but nothing more. If you like, we can do one more round of the studies. But if you see, I had done a video entitled Ivermectin Works, in which I went over various studies. That is the one that Dr. Paul Marik used as well when he became aware of the ivermectin. So in his very first ivermectin video, he had used a slide from my Ivermectin Works video. So Panoptic says, what is the risk of people over 80 using the Pfizer vaccine? So generally, it's not about the age. It is about the body's state. So some folks have the immune system which is working less. Some folks are too fragile. In Norway, what happened was that there were some folks who were too fragile to be able to take on the side effects of the vaccine. For example, diarrhea and nausea and cough, and they could not, they died. So it is not about the age, it's about the health of the person. And so that is where doctor has to assess the age and the state of the person and then decide if the vaccine will be okay or not. Westfield says, can you discuss why India is doing so well? Their curve is perfect and movie theater opening up full cap. Is it regular antiviral use? I think that they used hydroxy, they used ivermectin, and of course there were so much over-the-counter things available as well. I have been in touch with many of my friends there, and it's easier to manage there with over-the-counter ivermectins, hydroxys, steroids, compared to places like US. Places like US, we got bitten by these statements like EMA or the Surgisphere-like studies, or the Oxford study, which came out and said hydroxy is bad. Then the politics of it, that Trump has used the word hydroxychloroquine. So now one media outlet became against that, and they're still against it. And then the other media outlet said, we are for it. And it became politics instead of medicine. And I still wonder, those media outlets that became against it, don't they see the evidence now? Don't they see how Emma has rescinded? Would they now come out and they say, you know what, we were wrong, we should not have done this? No, they don't care. So over here we got stuck. I had done a video in which I showed a kitten who was all entangled in a cotton thread. So we have gotten ourselves entangled in these regulations, rules, and red tapes, and unnecessary, digging in our heels for medicine by journalists and politicians. That is just, I'm not a fan of what happened. Arun says, do you think worldwide increase in diabetic patients due to compulsory use of steroids? Please explain syncytia caused by SARS-CoV-2. So the steroids can create a temporary resistance to usage of the sugar or glucose. The reason is very simple. These hormones, the steroid type things, they are used in our body to prepare us as a stress situation. So Luffy is here. Let's see if he likes his catnip. he's munching at it. We'll see. He's gotten his catnip here. Okay, so back to Arun's question. So this could be temporary. And then syncytia caused by SARS-CoV-2. Can you, Arun, can you elaborate your second question a little bit, please? Kamran Jamil says, Dr. Drbeen, can you explain a little bit about different antibody tests and how to interpret the results? That will be a very interesting topic to work on. And it is actually hilarious to look at how these cats work with catnip. So Kamran, yes, will do. My apologies for being distracted with Luffy. Baby Milk says, I know it's a long shot. Dr. Bean answered this. Dr. Bean, are type O positive blood types who also have G6PD deficiency immune to COVID? Answer, no. But at the same time, I have actually done a video about blood types and COVID. So if you see here, what happens is, understand it this way, that in some people who become severely ill with COVID, one of the pathologies is hypercoagulability. That is, their blood becomes coagulated. In such folks, if there is any tendency of blood to be less coagulated, then they are a little more protected, but not immune, but not 100% protected. It says that it helps them a little bit more. That's all. And I have done this video. Please watch that. So Kevin says, does ivermectin work for Lyme disease? Ivermectin has a couple of things that are interesting. Luffy, please stop, man. What's going on? Okay, he played with his catnip, spoke a little bit, and then left. Okay, so ivermectin work for Lyme disease. So ivermectin is an anti-inflammatory. So any disease that would cause inflammation, for example, Lyme, it will reduce the symptoms, just like steroids would reduce the symptom. But ivermectin is not steroid, so it doesn't have those side effects. That is one. Secondly, imagine if Lyme is causing the release of interferon, suppressing the release of interferons or tumor necrosis factors, and causing the immune system to be dysregulated. Ivermectin does have some potential to help there. My suspicion is that ivermectin is actually helping by reducing the inflammation and not by adjusting the immune system. But as Dr. Phillips said that day, it may have a mechanism there that we need to study. So if I have a patient with Lyme, I would give them ivermectin to see what happens, and then see over the course of time, do they actually become cured, or is it that when you drop ivermectin, then the symptoms reappear? If they reappear, that means either the causative agent is still sitting there, or the immune system stayed dysregulated once more and is causing the inflammation. Good question. So Law W says, can you address study showing ADE in mice and primates? Definitely. I have actually done a video talking about all mechanisms of possible ADEs, and including mice and primates. Maybe that was the same one or something else, in which they also said that for COVID, they could not see ADE even after trying to challenge a primate, a chimpanzee, with the ADE antibodies, or sorry, COVID antibodies already generated, and then challenging them with COVID to see if the antibodies would act to create ADE, and they saw that this did not happen. So I can look at it again, but I would suggest please look at that video, watch that video first. Logic, I haven't seen you for a long time. Where have you been? Logic, does ivermectin work on obese people in your experience? How high of a dose is too high? Very simple. Once again, the dosage is calculated as 150 to 200 microgram per kilogram of body weight. So if somebody is obese, just take their weight and do the calculation, because the drug is going to be distributed, including in their fat tissue. Kamran Jamil, thank you very much for your super chat. So Chuck says, you're right, Luffy is worldwide famous and now join SAG for his singing career. He should. And the only downside is us, who are also his cohabitant in this place. And when he is on his singing mode, it becomes an issue sometimes. Okay. Raphael says, why the sky isn't falling now that a flu variant of H1N2 called AH1N2V was found in Brazil. People are going crazy with variants of COVID too much. WHO reported this in early January. Nobody cared. Raphael, there is a very interesting thing, and I would actually like you to do some study on that and maybe discuss that on Twitter. Interestingly, with the scare and the fear of COVID, we all have been homebound, and we've been cleaning ourselves and using sanitizers and washing our hands and social distancing. A result of that has been that the flu has actually gone downwards. So one reason that people are not too much alarmed by other things is that this COVID thing is all the time on our nerves. I think that once COVID is out, and I really believe that after vaccination soon, COVID would start going away. Israel is a good country to continue to watch because they have reached a very high level of COVID vaccination. And then I think once we become calm down from COVID, then you would see people starting to pay attention to these things. This is a good question. Where was that? I just saw a question that was very interesting. Here, David Cohen says, do you have or do you know of any COVID-19 patient who have had bad outcomes after early treatment with ivermectin? Short answer, no. A little more is that in one case, there is a cool bean whose mother uh, became hospitalized, and they started ivermectin a little late. They had to really convince the doctor to say, please do this. So her oxygen levels had dropped. I think her cytokine storms had started, and then they started giving her ivermectin. She did bounce back in her oxygen saturation for a couple of days, and then she could not continue, and she passed away. So that is one case where I had, it was late in the stage of the disease, but still with the bounce back with ivermectin, I became very hopeful, but then she did not survive. Other than that, in all cases, I have seen ivermectin to be very, very effective. Jeremiah says, do you know if they have done any studies on people with Delta 32 mutation to see if they are also immune to COVID? I haven't even seen this one. So, Jeremiah, is it possible to give me some more data? There is a question by Mike. How long after my second Pfizer vaccine am I relatively safe? So Pfizer said 7 days after their second dose is when the protection starts. So I would say add another 3-4 days. Actually, did Pfizer say 14 days or Moderna says 14 days? Moderna said 14 days. Pfizer said 7 days. So I would say about 10 days after their second dose is when, at least from trial data point of view, you are safe or you are protected. And again, the definition of protection is what they talk about in the trial data. Rico USA says, my friend had C19 and 8 months later had the Pfizer vaccination. He continues to have serious long haul heart condition. After his vaccine, I was surprised in the severity of C19-like symptoms. Is this typical? What was the, Rico, what was the outcome? Was it increased or was it reduced? Sipple Steve says, hi doc, have you heard about treatment of COVID with antivirals yes, so I have to talk about this. It is one of the notes I had taken. So give me one day and I would actually talk about it. I have it taken down as a note. Mike says, how long after my second? So we just talked about it. Chris Gotti says, Dr. Bean, so do you believe the numbers of cases and death that CDC reports is accurate? I actually don't see their numbers. I see the numbers from John Hopkins compared to the amount of regular flu cases and annually and death in the US compared to the prior years. I hope that they are correct. I mean, are there other ways to look at those numbers? Please tell me. Shemrayahu says, have you seen the new study using methylprednisolone? No, I'll have to look into it. Ivermectin prophylaxis failed, Janet says. Failed. Janet, is that a question or that is a comment? I know that there are question marks, but Nebu, there's a question from Naihu. Is there a test like for antibodies to demonstrate T cell immunity? No, so Nai, that would have been a great test. Of course, we can do that in the labs, but a standard test to see cytotoxic arm working is not there in labs, just like you can do with the antibodies. And I have been talking about this for a long time, that ideally to see if somebody is actually immune or has gotten the infection and recovered, not only the antibodies need to be looked at, we need to look at the cytotoxic T cells behavior as well. So Island Man says, my brother is on his 13th day of COVID-19. He took 18 milligram of ivermectin 8 days ago. So on the 5th day, and again 5 days ago. So on the 8th day, and he still feels really sick, can't eat. Island, of course, I cannot talk about any one specific person. Is it possible for you to talk more in terms of oxygen saturations? Being really sick is possible. It is the oxygen saturation that is more important. And secondly, for my patients, I usually, as soon as they become sick, I just continue on daily basis, but I don't give 18 milligram unless that is according to the body weight that is necessary. So Tube Sterini says, how many weeks can I take ivermectin prophylactically, safely, indefinitely? So this is one area where we actually do not have data. Ivermectin has never been used prophylactically. So if you look at how FLCCC said, Dr. Paul Marik and his colleagues, they say take it bi-weekly. One dose, meaning according to the body's need, 150 to 200 milligram per kilogram body weight every 2 weeks. I give it prophylactically to my patients every week. And then the studies that came out that looked at the prophylaxis, they gave it on day 1 and I believe day 3 or 5, and that's it, once per month, day 1 and 3. So if you want to go with the studies, then I would just say day 1 and 3 is a study. If you want to go with FLCCC, they have done it bi-weekly. I have a slightly different way of doing it, but nobody yet knows that what is the effect of continuous use, because it has never been used like this. Denise says, Denise, I just saw your, Denise says, do a lymphocyte. You said your dentist is still testing positive. The things just scroll up fast. Jack says, ever hear anything on use of ivermectin or brom in China? Not that we ever hear much about what they are doing anyways. That might be stockpiling it. Okay, so an interesting thing. In the beginning of pandemic, majority of shipments from Pakistan were going to China were hydroxychloroquine. And so my friends used to tell me that, man, all of hydroxy is being purchased there. I do not know today what are they doing. They are a little secretive in general, and so the data is not very clear. Rico says his long haul symptoms improved slightly after 3 days. Did he have long haul symptoms? Was he a long hauler? He said it was like he was infected a second time despite having antibodies 8 months ago. That's interesting. So maybe separately, can you please tweet at me or send me a personal message and we can talk a little more. I usually, whenever somebody talks with me, I usually request them to give me their clinical symptoms plus their oxygen saturation with breathing rate, with heart rate, with blood pressure. And then, of course, temperature and other things. So And once again, I can't really go for a specific patient until I'm their doctor, but I would just like to at least look at it and understand what's going on. Cool Bean 381, you have been out for some time as well. Welcome back. If COVID causes tendinitis, what would be the mechanism of action? I haven't seen this actually, that COVID causing tendinitis. I know that there is some drugs taken during the COVID which cause tendinitis, or severe weakness because of COVID puts a stress on the muscles. And when we try to use them, that causes muscle and tendon aches, and that can cause inflammation of the tendon. But COVID directly does not cause tendinitis, at least I do not know. Ali Akbar says, someone sent $100, man, people are rich. Dr. Bean, you're the most patient doctor I've ever. Jana Taylor says, the most patient doctor I've ever known. Thank you very much, Jana. Actually, I keep saying it. When I started these, I knew that I'm going to give my time. And I decided that this was a deliberate, thought out decision, that I left everything. My family knows I do it every day. And they know that there is a curfew after 12 or 1 during the day, that nobody can talk with me because I'm now studying and preparing and looking at questions, looking at news, looking at studies. So they have been going through this with me for a year. My team, my business knows that I will not be available after 1 o'clock. And some of my team members in the bigger positions have been upset with me, and some have been very, very supportive of this. So because I had made a decision, and I'm telling you the truth, don't tell anyone, especially not my other team members, that I thought that even if the business is impacted severely, I am going to rise up and serve at this time if I can. And then I'll see what happens to my business afterwards. So because that was the intent, now it will be incorrect of me to sit here and start being impatient, because then I would have just ruined all of that intent and the time availability and work for you if I cannot then convey it to you. You are very welcome. Greenheart, very welcome. Very welcome. Thank you. So Nina says, Dr. Bean, why aren't you on the task force to teach Dr. Fauci something? As much as people think that somehow I may be a Republican, and because of that I'm against Fauci, it is actually not true. I don't actually bring in my politics in this. I'm not happy with Fauci's work. And no, I think it is evident from my previous discussions. Somebody had even sent me a message that I would stop watching you because you are against Fauci. And they said, look, Fauci's been under so much pressure that people have been sending them death threats, and his family is under pressure and so on. And I totally empathize with that. I have been receiving death threats, or threats to become jailed, or threats to be financially ruined, or threats to be, I don't know, many things. At the same time, and I'm a small fry, so I can understand that he is sitting in a bigger position, so the attacks towards him will be a lot. I don't care for this part. What I importantly care for, and it doesn't mean that I don't care for what people are saying to him, meaning that is not what is driving that I should just become part of those who are attacking him. I do not like the leadership that he provided. And so we'll see. It seems like he says that he was under pressure. So maybe now he will do something better. But vitamin D, hydroxychloroquine, ivermectins, the approval for these, the studies for these, how come a thing like bamlanivimab became approved So do you know, let me share my screen for a second and share with you how upset I am about this. And again, not if bamlanivimab is useful, awesome. But check this out. Bamlanivimab's study. It was like this. There were about 460 patients. 100 people in one dose of BAM, another 100 in another dose, dose of BAM, another with a different dose, and then 100 with placebo. So look, these are different doses. You cannot accumulate them to say there were 300 people on BAM. No, they were really 100 people, whichever 100 you want to compare with placebo. So if you take 100 people, compare them to placebo, and then you say, you know what, approved. And you have much more data for hydroxy, and you have much more data for ivermectin, and you don't even bat an eye. That is what makes me upset. So then DM says, wear 2 masks now, next it will be wear 5 pandemic. So actually DM, there is some benefit of wearing 2 masks. Let me explain how 2 masks can be useful. Here is, imagine this is a surgical mask. This is just my tissue here, which is sitting next to me. Imagine that this is a surgical mask. And what happens is that in this mask, surgical mask has a outward protection and inward flow protection. And the outward is more and inward is less. So now imagine if you took one surgical mask and put it straight, and then put another surgical mask and put it the other way, and then used it, you actually improve your inward protection and outward protection both. So from that point of view, 2 may be useful, 5 may not be useful, 10 may not. They may actually become counterproductive, because now they would be so thick, just like, let's say, this hard cloth, that air would now start leaking from above and other corners. So a couple of surgical masks are interesting. There has been another super chat with another $100. There has been a super chat with 4. So everybody, thank you so much. David has $100, and then Tommy Cash says, do you know Dr. John Campbell? So yes, I know that he is a nurse who is a PhD. He does very good work on COVID as well. His channel is quite popular. I tried to reach out to him to have him with us a couple of times. He just did not respond. So yes, I am aware of him. Good work on his end. Then the only disagreement with his approach that I have is, number one, he scares people a lot. I watched a video of him saying that this is the most serious video I've ever going to make in my life, and that this is going to happen in Africa, and the 23 million are going to, and that was just too much of a fear mongering. And the second thing that I see is that he actually is by the book with the medical authorities. And so I don't see those other things. For example, reaching hydroxy or talking about Ivor, it took a long time. But still, great work he's done. He's done more work, and he's watched more than me. So who am I to criticize him? He's done some good work. Sharon, thank you very much for the super sticker. There was another I just saw here, James Crooks, 699. Thank you. My partner, much calmer watching you. We are even taking your immune system lectures for increased understanding. You're a blessing to humanity. Thank you very much. Thank you. I saw one more question here with a super chat. So let's see if I can find it. The messages just scroll so fast. Okay, so it has scrolled. Andrea says, thank you. You're very welcome. Logic has a logic question. I have proud of you. Thank you. So much more popular this year is in such a short time. Keep up with the shorter videos and add a nice thumbnail, something flashy. We almost have a lost original gang now. Yes, absolutely. And I think one of my issues is that my videos are longer. So people are hesitant to watch longer videos. But the problem is that sometimes explaining medicine or having this discussion just takes too much time. Excalibur says, I'm a manly man and man's man. I have learned a lot from you and I have protected my family with your information. I love you. Thank you. Love you too. Thank you very much. Mike says, Dr. Campbell is great. Yes, he is. Trevor says, like Campbell and Dr. Mubin, thank you very much. Pigpug says, Dr. Bean, you're way more in depth than Dr. John, and his diagrams aren't nearly as exciting. Thank you. Adnan says, Dr. Saab, today our Punjab's health minister told us that you are at your own if you want to be vaccinated. Is this right? Or they know that vaccine from China is dangerous? Please answer. I have very less data about China's vaccine. So, but I'll tell you this, my own friends, I had asked them to take vaccine. Whatever vaccine is available, I had asked them to take it. So it would be incorrect of me to sit here and tell you not to take it while I ask my friends to take them. So my message would be the same for you as well, that if that is all we have, then yes, please look at whatever data they have and then decide if you can take it, then take it. John, you're correct. Tommy Cash, thank you very much. You think an N95 with a surgical mask over is a good? No, N95 alone is sufficient. You don't need surgical mask on N95. Staple Steve says, any news on the new vaccine being produced by J&J? It is a one-dose vaccine. Yes. So I actually did a video. The title is, will you take this vaccine? In there, I discussed the J&J's vaccine. I did one more video, you would love this vaccine, and that is about the, what is that? The Novavax vaccine. And very recently, I talked about the Coronavac as well from, or what is that? From India. I forgot the name. Logic says, we need a private group on Facebook to aggregate what we think should be your next videos while supporting one another with information and resources. Absolutely. If you say we can make a new group, I have a few groups already there. We can create a new group if you like. Please, can you tweet at me, and then we can discuss that. Tommy Cat says, give Luffy a pinch of catnip, Muya. He has actually ran away with his catnips. Will do. Thank you. Yes, I think that diabetes, cancer, and the chronic diseases like Lyme are very important things to look at. So if you like, I think in next 3-4 months in US, pandemic with COVID is going to be ramped down way much. And we would be either, we would not see each other that much again, or I'll be here, but you would become busy with your own lives. But if you would like some other topics to continue, we can start planning for them now. Yes, Covaxin from India, correct. Yes, Jeev. Sorry, I forgot the name. David says, no, I'm not on Facebook. Maybe we should create a thread on Dr. Bean's forums and then use that for discussions. Shamar Yahoo says, have you heard of peak prosperity? Yes. Not only that, interestingly, peak prosperity used one of my videos about ivermectin, and he used many of its slides and then mentioned my channel as well, and talked about that video and linked that video in his description too. So he was quite a gentleman that when he used it, he did a lots of um, recognition as well. One extra says, I'm sure Campbell watches your videos, Dr. Bean. He never mentions you. No worries. um, Thank you very much, Mark. So Northern Lights catnip, thank you. Yes, peak prosperity is good. Yes. Debbie Boss says, but long haulers will still be around since it's a persistent virus in some people. Yes, that is, Debbie, that is something that we need to continue to work on. You are correct. You are correct. Mario says, you can focus more on diabetes and heart disease prevention and management. I think that, Marlo, I think that is a good idea. Nina says, whatever, you're never getting rid of me. Thank you, Nina. I don't want to get rid of you. M says, watching from Sri Lanka, that I watched previous video related to COVID-19 medicine. Is Nigella steva with honey is better to heal? Thank you very much for watching from Sri Lanka. I have a number of friends in Sri Lanka and Nepal. Cool Bean Kids Table. Yes, we should do that. This is a very common question. Monique says, do you think PCR tests are reliable? This is important for me because my husband thinks it's not. A test by itself is not sufficient for reliability. And that is because it has to be combined with the positive predictive value and negative predictive value. I did a talk about this about 6 months ago. If you look at my channel, there is going to be a talk about positive predictive value. Every test, not just a PCR test, antibody test, or other tests as well, every test has a chance of error in it, of failure in it, because the sensitivity and specificity is usually not always 100%. So to bring it to a more, even more accurate stage, what we do is we add positive and negative predictive values with it. These tests are actually very sensitive. They go up to 99% sensitivity. And I think their specificities are very high. I have done these discussions with the links to CDC, with each test that CDC has or FDA has approved, with their sensitivity and specificity, and what does it mean? I have explained it. So to shorten my question, yes, they are predictable. How to statistically see their prediction and what does it mean? I have done the talks about it. You get censored on Facebook. I know. I know I get censored on Facebook. I used to get censored a lot on YouTube. In the beginning, people were very upset with me as well, that who am I to talk about COVID and talk about hydroxychloroquine and other things. And so I used to get a lots of threats. Nowadays, I don't get enough enough threats. And secondly, nowadays, I don't get my videos taken down that much. Remember, YouTube used to take down my videos all the time, but nowadays that has become less. And so now they demonetize very often. So maybe when people say, hey, this doesn't look right, they demonetize it. Then I go back and I ask them to do a review and they put that back up. But at least on YouTube, I'm given a break. On Facebook, people still tell me that when they share it, Facebook either blocks it or they say you're doing something wrong. I don't know what else, how else can medicine be other than looking at the mechanisms of medicine. You are correct. Dr. Corey is doing a lot. Rico USA says, how would you apply ivermectin RCT data improvement to key outcomes, reduce infection, reduce hospitalization deaths? In other words, can we project the positive impact that ivermectin will have on outcomes based on the current trends data? Absolutely. Many of the ivermectin studies have statistically significant data. That means you could use that data and then apply that for the similar cohort and say, this is what should be the outcome. Rima says, I share your videos. Thank you, Rima. Anagha says, please answer my question. Anagha, what was your question? Let's see. I'm trying to see if I can find your question. Thank you. Yes, Covaxin is a name. Anaga, I cannot see your question. Can you please write it down again? Shayur Ramdat says, are the super chats $100 US? Yes, but please realize this, that I have never not answered somebody's question because they had not done a super chat. You're all welcome. The ones who are doing a super chat, thank you very much for your help and support. At the same time, I've never tried to not respond. Shahdevar says, what is ivermectin? Why is it so effective with this virus? Shahdevar, if you go to my channel, and then over here, if you look for, let's say, I go to YouTube, I say Ivermectin Dr. Bean, you will see a number of talks about ivermectin. My recommendation is that check out, look at how many talks I have, how ivermectin helps against SARS-CoV-2. It's a small talk, 29-30 minutes, but it has a lots of mechanisms in it. Then the latest one, updated ivermectin mechanism of action. This one, again, small, 25 minutes, and this has all the actions of the ivermectin in it. After that, if you wanted to see more, this is ivermectin with its side effects. And then ivermectin with doxycycline, without doxycycline, various studies about ivermectin and what have they proven in those studies. Ivermectin studies, prophylaxis study from India, and ivermectin talk with Adam Gartner, ivermectin, Abbott, dogs, and ICM protocol. So then here more. So there is a bunch of talks. You can go to as much depth as you want. Rico USA says, no need to apologize. Totally fine. This is why I'm here. France says you have lots of talks. Yes, France. I did not know that I have so many talks about ivermectin. Even Dr. Paul Marrick's eye mask protocol, which is also ivermectin, is there. Rima says I watch them again and again. Thank you very much. Bill says, hi, Dr. Bean. A recent paper has shown that the prescription nasal spray, I have to work on this one, this nasal spray. I've taken that as a to-do. So I'm going to look at this one as well. I have to check, why is it adding protection? Is it that just like mouth washes, it is keeping the system clean? Or is it that it is adding some immunity here? Or is it that it just sticks here for a longer period of time and keeps I have no idea how is it working. I need to look at the mechanism of action. Lucy says, I watch Dr. Campbell and Dr. Bean each day. I gain enormously from this and appreciate all the work. I love Luffy's taking part in the conversations. Yes, Luffy is going to take part in the conversations regardless of how we feel. Sally, thank you very much. Luffy is back. So there is a question from Adnan. Sir, as you said earlier, that if we take one inactivated and one with spike vaccine, we will be safe enough. Mean one Sinopharm and one AstraZeneca. Inactivated has spike protein with it. You don't need to have the AstraZeneca as well. Having said that, AstraZeneca alone should be sufficient too. So take any one of them. Anag Dalvi says, I am quite disappointed. Anaga, why are you disappointed? Anaga says again, I also guess it can be given, since he's an expert, wanted to know. I have no idea. Where is your basic question? I'm trying to find it. Looks like you're disappointed that I'm not able to find your questions. I am disappointed as well now that I cannot find your questions. Oh, I just saw something. Anaga, write it again, and I'm going to just keep looking at the chat and make sure it doesn't go away. Meanwhile, I'm going to answer a question from Debbie. Hi, Dr. B. Did you ever look into artisunate as antiviral, since it crosses blood-brain barrier, better for long haulers with CNS involvement? I have not. I would have to. So let me take this as a note, Debbie. Okay, so I took a note. I'll look into that. Let me go down and see if I can find Anaga's. I actually saw something. Here, Anaga says ivermectin with blood pressure meds, beta blockers. Anaga, what is your question? Is this the question? Ivermectin with blood pressure? Ivermectin has no role. So Pigpuck says, if she's asking if the beta blockers, ivermectin has no known interaction, but the best way for individual drugs, the best way is that I shared a link yesterday to the drug side effects, metabolism, and cross interactions from the manufacturer. Please look at my previous COVID questions this Saturday, that is day before yesterday. In there is a link, and in there they have any drug interaction that they've talked about. What I remember from that document is they say there are not a lot of interaction because it works with the liver enzymes that are not usually used by other drugs, but still, please look there. Okay. Hassan says, how is the vaccine preventing cytokine storm? Very simple. Vaccine prevents cytokine storm because it prepares your immune system to attack the virus as soon as it comes in. So now when the virus comes in, within 24 hours, our immune system starts killing it, and the virus doesn't get a chance to spread widely in our body and cause too much of immune system dysregulation to cause cytokine storm. It's just that it doesn't get 5, 7, 10 days to bother us or our tissues and destroy them and cause immune dysregulation. Samina says, what are the possible reasons that we lost many of our frontline fighters, in your opinion? Of course, I think different for each country, but exposure to the COVID, exhaustion, their own immune system, the tension, the stress, their own immune system not working as good. In many countries, I see that their PPEs are not correct. In many countries, I actually see that younger doctors are exposed to COVID more than the seniors. So seniors stay back and just let the youngers do the work. So I think it is different from country to country. Cool. So how about we break now? It's almost about 2 hours. Adnan says, how old is your Luffy? I think Luffy is 6 years old now. 1x2 says, peak prosperity are planning a live chat. Many folks have started doing live chats after we do it regularly. I think it is actually a good thing to directly discuss things. Walking Tall, how are you? Okay, good. So there is one more question and then we break. William says, will SARS-CoV-2 stay around forever just like MERS-CoV since we can't find out what the intermediate host is? Yes, but I also think that the massive level at which we are vaccinating and becoming infected and becoming immune, I think that even if it will have to live with us, it will have to figure out a more adapted, less lethal state in which it can be with us without bothering us. Otherwise, we are keep going to eradicate it and eventually it will have to go away because humanity cannot live like this forever. So we are going to eradicate it if it doesn't behave. Cool. So let's break here for today and we will continue our discussion tomorrow. I'm going to pick up some of the topics that we've been talking about and then talk about them tomorrow. Walking Tall, thank you very much. Thank you. Thank you. Coffees are great. So just normal customary thing. Please like, subscribe, and share. There is a link in the description if you wanted to buy me a coffee. And there is another link in the description if you wanted to just support my work. Thank you very much. And I would see you tomorrow.